Raindrop surgery. The raindrop near vision inlay is delivered in the cornea following a procedure similar to LASIK. After draping the patient, including the eyelashes and placing a lid speculum, create a femtosecond laser flap with a diameter of 8 mm or greater and targeted depth at 30% of the central cornea thickness. The corneal flap must be a minimum of 150 microns thick, and the residual stromal bed must be a minimum of 300 microns thick. Using an instrument such as a Seibel spatula to open the edges of the flap, break up tags of the interface, then lift the flap as shown. Folding the flap is not recommended. The stromal bed must remain dry, so do not rinse the interface with BSS. Increase light brightness so that the pupil is approximately 3 mm or smaller in diameter. The raindrop comes preloaded in a titanium inserter, and the surgeon can access the inlay through a small slot at the tip of the inserter. Once the flap is lifted, gently place the inserter tip onto the stromal bed centered on the light-constricted pupil, creating a small indentation on the stroma. To deliver the raindrop inlay, place a second instrument, like a disposable 30-gauge cannula, a 0.2 mm Sinskey hook, or a Barriquer spatula in the inserter's opening to hold the inlay on the stroma, then slide the inserter away from the raindrop near vision inlay. Utilize the elbow of the Sinskey hook or the spatula to manipulate the inlay into position, centered on the light-constricted pupil. Be sure to pull the inlay, not push it. Visually inspect the raindrop near vision inlay for damage. In order to get the inlay attached to the stromal bed, allow it to dry by letting it rest on the stromal bed for approximately 60 seconds without manipulation. While waiting for the inlay to dry, maintain the hydration of the epithelial side of the flap with BSS. When dry, the raindrop takes an orange peel appearance and blends with the stroma. Reposition the flap by placing a small amount of BSS at the hinge and stromal surface of the flap, and then close the flap back with one smooth motion. Avoid any irrigation under the flap, as this may cause the raindrop near vision inlay to become misaligned, damaged, or lost. Visually check to make sure the flap is in proper position. Using an eye spear, gently clean and dry out the excess fluid on the cornea and check that the inlay is still centered over the light-constricted pupil. The raindrop implant is now completed.